Last Friday, I worked with, I've got 4 contacts at DOH, and we sat down and worked through the MOU. We kind of went line by line through the MOU. We talked about how Mason County is set up for contact tracing, who we already have as contact tracers, and what we would need in the event of a surge. Came to a number on that. And then we talked about what it would take to stand up Building 10 and our alternative care facility for non-medical people just to be there. And we came to a number on that. It basically is 2 people per shift at 8-hour shifts, so 6 people a day. And they're going back with their folks and making sure that they have all that in place. In our conversation, we talked about they haven't done many. They've only done one of these before, and that's I think through Lewis County. And after talking to Lewis County and talking to us, they may require this in phase planning for everyone else, just in order to get a line on what resources we're going to require should we have a surge. And I just want to make sure that we're at the head of that line on this surge planning. So in case something doesn't fall. Right. That and it really gets the DOH to buy into our phase 3 plan. So it gives them some ownership in the plan as well. And I think that's always a good thing. I am now in WA Health, so I have the ability to go into WA Health on the backside and look at the inputs from the hospital and DOH and us as we put stuff into WA Health. And I looked at the dashboard this morning, and right now we're showing green on all 5 categories, which to allow us to go into phase 3. So we'll keep monitoring that until Friday night, and then we'll lock that into the plan and then move forward with that. So with that said, let's talk about the plan and moving from here into phase 3 and how we want to go about it. So I sent out an email last week talking about some thoughts we had. The recommendations from the area command and from staff were to pick a date. So the soonest we can go is the 13th. And John Weisman was very clear. He wants to see no board actions before the 13th. He wants full 21 days of data in the system before the Board of Health or the Board of County Commissioners votes on it. So that really puts us to a special Board of Health meeting on the 15th and probably a 16th meeting of the Board of County Commissioners to approve. So again, it's the same as last time, and that we needed a letter from Dr. Stein, a letter from the hospital, Board of Health approval, and county approval. So we can get those things done and sent.
And the hospitals too. Right.
Yeah, hospitals too, right. So there's four pieces to it. We could probably send those out to DOH on the 16th. Not knowing when that's going to come back to us. So John said it could be 3 or 4 days.
And I think he also, it is taking more time.
Right.
They're not just getting it and moving automatically. Right.
So, so June 16th, we could have an answer on June 20th, which that's a Saturday. So what staff had recommended was a go-live date on June 22nd, which is a Monday morning. That would give us a chance to start a immediate push on the 17th that would go through the 22nd to make sure that we hit all those points that didn't get hit as well last time. And it also gives us a time between now and when we lock this thing down on Friday for Dr. Stein. We met with Dr. Stein's staff last week, and we went through the phase 3 sections of high-risk populations, recreation, gatherings, non-religious, travel, business employers. And we had some questions around from the health officer around weddings, venue guidance. We're going to look at that this week. We still have for phase 3, the only thing we have is out right now is recreational. So all the other pieces of phase 3, which we can't have anybody move into until we get that guidance from the state, and it's not been published yet. John expected it to be published by last Friday. It didn't, so it should happen this week. So venue guidance, health officer order. Some things we're talking about is long-term care and visitation. Some of those things, it's really become kind of high on our priority list. We have people in long-term care who have had no visitors since March or maybe in February. And so what does that look like in long-term care in giving people exercise and mental stimulation and physical stuff going on? So that's a question that we'd like to see answered for phase 3 guidance, is what can we start doing with long-term care and helping those folks get their needs met as well.
Can't imagine not being able to see my parents since March.
Right. And they're not allowed to eat in the congregate setting. They're eating in their rooms. They're very, very restricted to their rooms. So they're not getting exercise. They're not getting the emotional and mental stimulation. So we'd like the DOH to answer that, but it's really not part of the phase 3 timeline. It's just a part of a concern that we have as public health about part of our population. So in addition to that, we're also talking about and this came up this weekend, reaching out to the Hispanic and non-English speaking populations. And thanks to the Commission for helping me out this weekend, because we were kind of scrambling trying to find the right people. We had some interpretation difficulties, and we've worked those through. And now that's kind of all de-escalated. But we talked to the PIOs this morning about getting this message out. As we go into phase 3, the areas that concerns us are people who work congregately, travel in vans, agricultural workers. I don't want to see happen here what happened in Yakima. So PIOs are working on messaging today. We're going to start getting that out to pastors and figure out what method works best. Putting it on Facebook is probably not going to reach everybody, so let's get it to the pastors, I think, and have pastors reach out into their own congregations in the way that they're meeting now. Like my church is meeting by Zoom. So if we had a video that the pastors could put on their Zoom meeting, that would be cool too. So we'll work on that. So what I want to come back to, though, is we have on the phase 3 timeline some options. We could say as soon as DOH approves, we could pick a specific date, or we could pick a specific time frame, after, like 24 or 48 hours after DOH approves. So I just need to know from the Commission how you would like me to write this up.
I would say, my opinion, not less than 48 hours after approval.
Because that also gives us time to review what's lacking or what needs more attention.
Okay.
Well, with that, because that's been my issue with it, it's just Dr. Stein and stuff was not given an opportunity like we had discussed to be able to roll things out. And even if we just have a drop dead date like that, we're still going to end up in the same position. The thing I brought up before, I'll bring up again, hopefully you guys will consider it, is that we do it in the form of rollouts. Separate things out in 2 or 3 different divisions, bring it to the Commission have recommendations from staff, these ones go that day, we just have a couple extra meetings. But this way it makes sure that the next level is achieved. If it isn't achieved, it drops down and it'll come back for the next meeting, and if it's not achieved then this way we let it go piece by piece, instead of how this last one happened, when I know that people were opening without precautions, even though a lot of them did great. They did wonderful work, and they really took great precautions, and they caught up in the end, but it was that first few days that was the most dangerous in my opinion.
Well, and I think too, there's maybe there's an opportunity to separate it out a little bit. Some of phase 3 is an expansion of businesses that we're able to open in phase 2 and operate, and it's just increasing their capacity, right?
Yes.
Right.
So maybe we treat those one way, and then we look at what is new under phase 3 and start
would
to
require
really,
special guidance.
right?
Yes.
And kind of go at it that way at a minimum.
That's exactly what I'm hoping for, because I would hope that the low-hanging fruit, the ones we know that we can handle, we can do, would be the ones that you brought to the Commission after it's approved. We have a special commission meeting, just like we've done in the past. And we, as a commission, say, these ones are ready to go, and it goes this way. They also know it doesn't happen until we say it happens.
Right, and that needs to get out on the media too, because
Right.
the media, they knew before we did.
Yeah, I know, we
Yeah.
threw it out there.
So,
Okay, so that would need to be in the plan, and would also need to be in the front page of the letter for the plan, so DOH cannot miss it and the public cannot miss it.
Mhm.
right.
Because I agree, we had an instance where we've had to scale back and do a health officer order on our ballparks, because although they're allowed 5 people, people were showing up with whole baseball teams.
Mhm.
So basically we had to use a health officer order and just say, you know what, if we can't meet this standard, we're just going to stop.
And we don't like doing that.
No. So, okay, well, that gives me an idea of how to write this. I will have a draft out this week. I'll have a draft to you by Friday. What about the rest of the timeline? Do we still want to do a Board of Health on Monday and Board of County Commissioners
On Tuesday.
on Tuesday? Really, I would need to have the draft written by Wednesday morning, by noon. Okay.
Yeah, I'd still rather do things, I'd still rather do things as fast as we can. I would rather not wait things out, but at the same time, as long as we're making the decisions of what gets rolled out, then
Okay.
I don't think we have to wait.
So I would maybe offer this as an alternative. Do both Board of Health and our commission meeting on Tuesday.
Yeah.
Okay.
That way that gives us Monday and briefings to review everything one more time before,
Okay.
and then we're not any worse off time-wise.
Okay. That makes perfect sense.
And if we end up going the other route where we have pieces that we put out, we can do it just like we did before the emergency meeting. We can be there the next day if we need to, and get the easy parts out and hold off on the ones we don't have all the plans for. Because they're all gonna think that it's phase 3, even though we don't have plans for
Okay.
it.
Yeah,
I can-
the state doesn't have the guidance.
Yeah, and
It's kind of hard to move
it
forward.
was also the guidance that our health officer agreed with, is
Okay.
the deal that we made when we.
All right. So, all right, because Dr. Stein was going to get back to me on some of these things and tell me if he had any concerns on these. And then I think especially the parks, the gyms, outdoor rec of greater than 50. I think maybe look at those, especially for county properties, right?
Right.
The government-facing, the customer-facing governmental services. We want to pick a date on that, because that's how we let all of our employees know to prepare to be ready to bring customers in.
I'd like to hear a date.
The 17th is when the OPMA expires,
Okay,
restrictions, and it expires at 11:59 on the 17th.
Well, it's a little bit different though than customer service.
Yeah.
well, how,
That affects our meetings versus
Well,
reopening to public coming in for business.
so what about the 22nd, which is a Monday?
I'd like to hear from the offices that deal with,
Okay,
I was gonna say, I'm in agreement. I'd like to hear what the office say, and even if we have parts of it open Monday, I'm good with that.
okay,
If we're prepared, I just don't want them to be
If
not
they're ready.
prepared. Yeah.
especially in light of the auditor, assessor, and treasurer looking into,
Yeah.
you know, a management of, customer management program
okay,
up there. I don't know where we're at on that,
Okay.
or where they are on that, so.
And
Yeah,
even if we're not, probably not gonna get that in time, but they still gotta have some type of, situation set up so that we can keep staff outside, keep
Okay.
people outside, keep people in the lobby.
Keep staff
And I'm okay with that, I think I have a problem with it, we'll move the desks outside, it's the safest place.
Do class
to do it.
outside this
I'm good with
today.
that.
okay. All right, well, I'll shoot it, DCD and Public Health are ready to go on the 22nd. Actually, they're ready to go whenever. But we have to give staff enough time and enough notice.
Yep.
So, okay, I will reach out to the other folks.
Perhaps we can start telling everybody though that, our goal is the 22nd for opening and let them start that process now. Even if we don't get approved, so if we don't get approved, they don't know, but at least they'll be prepared, and we'll give them more time than just wait for the last minute.
That's kind of what I did with the baseball teams, because they were all looking at, do we cancel completely? I said, well, this is what we're looking, but here also, because luckily enough, we did have the state's, the DOH's guidelines. Here's the guidelines you gotta follow. So they understand the rules of, if this does happen, this is when you do have to still have the 50 people in the max. And that's per field, 50 per field. So basically, it's just the teams, no spectators.
Yeah.
Well, not at 50 per
Really,
field,
yeah.
not at 50 per field, that's,
Yeah,
How many kids are on each team?
15, 10?
Should we look at having a conversation about limiting how many fields are available at a time?
That one area there, I'm thinking North Mason, I'd love to have North Mason open, I really do, but again, safety-wise,
A common area?
yeah, they got an area that they all share.
Yeah.
And so you put 50 per field and you give 20 parents that are out there on each one, that could be.
There's gonna be,
Yeah.
there's gonna be congregating, and so,
Yeah.
I mean, what,
And then there's
if you have,
concessions too.
how many fields do we have at Sand Hill.
7.
Yeah.
So that's 350
7 there and
people
7.
potentially,
7 at both, yeah.
you know.
7 at both. The one nice thing about Sand Hill, though, they're spread out really well.
Yeah,
Except for
well,
4.
I was gonna say,
Except
they're
for
spread
four.
out if they're there, but if they're coming to do something in the middle, or when they show up, they all go to that one area first.
Yeah.
Perhaps, you know, this is one of those ones that we're talking about, let's put together our own specific proposal on how we want it done, and that's what we release when we release it.
Right. I agree.
And if we don't have it yet, then they have to wait another week or
Mhm.
whatever until we have it, because we, you know, on that one there, I know we'll have a lot of elderly people there. I know that because I go over the years, that's why we put in the handicap, because literally there was a lot of them. And they want to see the grandkids, they want to, and so they will go. I don't want to
Yes.
put them in danger just because we're all in a hurry.
Yeah, I've talked to
So
several
again,
of the
public,
coaches.
hey, public, I want it to open, I just don't want anybody to get hurt in the process.
I've talked to some of the coaches and the people that run like Dark Mason Little
Let's
League,
get some new stuff. in
and
June.
the coaches that,
Yeah, but-
they're good about it, they understand what's going on, so they're pretty good.
Okay, I just got in from John, some clarity on going from phase 2 to phase 3. He says all the templates, guidance documents from phase 2 carry on into phase 3. And then there will be.
John Weisman.
From John Weisman, Secretary of Health. So, those will continue. There will be new guidance that is specific to certain industries. And he's just sent a template that says for those industries or businesses that don't fall under specific guidelines, here's a template that you can just fill out and have in your business in order to meet the state guidelines for every business. So I'll shoot that out to the EDC and I'll shoot it out to both chambers and we'll stick it on the website so that all businesses will have access to that template and are able to get that requirement done because they have to have a sign at the front door and then they have to have their plan in-house, so,
And you can put that on the website too.
yeah.
Yep.
So far going around, at least in North Mason, they're really working hard to comply.
Yeah.
They really are. I'm really happy with them, proud of them.
Right.
Either way they
Businesses
do their,
I've seen.
yeah, their haircuts and everything, they've got it down.
Yeah, you have to call up and get an appointment, and I haven't been able to make one yet, so.
Yeah, kind of seeing that. a little
Yeah.
bit.
Thanks. Yeah, you get a little shaggy, yeah. Okay, any other concerns about the phase as I write, because I'm gonna be really busy the next couple of days putting this together, making sure all the pieces are in place.
Again, I'd just rather do it as soon as we can, instead of stretching it out. I'd rather do it as soon as we can and then start our process.
So, okay, so we're looking at 48 hours after DOH approves with these guidelines. Okay.
Yeah, so I mean, maybe, you know, for another review from us, you know, have it broken down by sector and then say, you know, this is.
With approval of the commission.
Right.
Instead of the 48 hours, I'd rather see the approval of the commission. If we have a meeting in 24, that's great. If we have a meeting in 72, because we have an issue. What do you think?
I think we can have it ready within 48 hours.
But I mean, do you want, instead of telling the, even if you tell the public 48 hours, they're gonna open up 48 hours, unless we tell them that it opens on the approval of the commission. That's my worry,
If you put a date on it, they'll stick to it.
because they're not gonna read the rest of the,
Can you ask Dr. Stein? I'd like to go with his recommendation.
Okay.
Yeah, and that's, I guess that's kind of where I'm headed is, you know, per sector of, you know, phase 3. So like I said, with restaurants, we use that as an example. They're moving from 50% to 75% capacity. That could have, you know, as part of our application, maybe we put, you know, that happens immediately. For the ball fields or whatever, per commission action,
yeah.
Okay.
you know, we're gonna do X, Y, and Z, and let's, you know, if we maybe spell it out in the application pretty explicitly first, then maybe we don't have to worry about coming back and doing another meeting after it has DOH approval.
Yeah.
Okay.
And it's just clear that DOH is approving our plan
Yeah.
to limit ball field access, if that's what we decide to do, based on Dr. Stein's.
Yeah, just separate them out, please, so we'll know how we'll look at it.
Okay.
And I'm good with that, the ones that we know we can handle, I may go with that, even going right, as he said, right, since it opens. I'm good with that. It's just the other ones that I'd like to keep
Okay.
control over. And if they know it up front, we have a better chance of keeping
You
control.
know, or we say, you know, restaurants go to 75% capacity on June 22nd.
Okay.
And that, you know, so I'd like to maybe see it broken down and then a couple of auctions and then we kind of,
And Father's Day is the day before,
Right.
it's on the 21st.
okay.
Well, let's open it for
Just-
Father's Day.
See,
It wasn't open for Mother's Day.
it wasn't open for Mother's Day, but we can't,
Jealous.
I don't know. I wouldn't want a father to be left out because, you know, it was tough on Mother's Day. It really was. It was really hard. And I want fathers to go through what I went through.
Father's Day is barbecue day.
I'd say my mother, or
I don't
my
know.
wife got breakfast, I got a breakfast in bed, she didn't miss any of that.
Yeah, my kids weren't here, so.
Well, okay, whatever. I mean, I just,
Okay.
like, I just want us to know what we're doing ahead of time and, I mean, if, whatever. So I'd like to see some options.
Okay, so I'll get this out this week. We'll rebrief again on Monday. And then if we need to, we can rebrief again on the following Monday. No, we need to rebrief next Monday. Action on Tuesday with the changes we make on Monday.
Mhm.
Okay. Okay, we can do that.